Hello, my name is Roshana Milliken. I'm a student at Waynesburg University. This is for my class called Professional Issues in Nursing. We're going to be talking about bullying in nursing. You may have heard the phrase nurses eat their young, and this topic refers to that stigma we get as nurses. Bullying in nursing is a person who intimidates or harms nurses who they believe are vulnerable or incompetent. This happens frequently to new nurses because they don't have the experience or confidence while they are practicing. The person who bullies these nurses have repeated behaviors that include intimidation to that new nurse. They disturb concentration with that nurse while they are working and trying to learn. They inhibit collaboration with that nurse between them, other nurses on the floor, doctors, CNAs, and this can impair patient care communication. This is also known as horizontal or vertical violence. Horizontal violence would be someone that's like your peer that works with you and a nurse that you work with. Vertical violence refers to someone who's above you. It could be a charge nurse, a supervisor, a manager. So violence in that area would be a little bit different compared to someone that is your equal on the floor. These nurse bullies may be upset, stressed, humiliated, or vulnerable at the time. They may be unable to handle stress that is occurring in their life. Other nurses may follow like a main nurse bully and fear that if they don't follow that nurse bully, they're going to be bullied as well. So it's kind of like a trickling effect. And high stress working environments tend to have more bullying going on. And I think that's because it's a more fast paced area and newer nurses that are trying to learn and accommodate to that unit may be slower, and this might frustrate and stress out the nurse that's trying to orient them or the nurse that is just a bully in general that works on that floor. Consequences of horizontal violence or vertical violence includes an increase in errors, increase in cost of care, increase in the nurse turnover rate, specifically to newer nurses. The younger nurse, the newer nurse is more likely to leave compared to an older nurse. Also, there is a decrease in patient satisfaction and decreased role models. So there is a study done by Armour and Ball. It's called Perceptions of Horizontal Violence in Staff Nurses and Intent to Leave. This study was done in 2015, and the study shows that 28.8% of the participants agree they are planning to leave within the year. That's a good bit of nurses planning to leave that job. Also, they state to train a new nurse or to replace a single RN is between $62,000 to $67,000. So that is a lot of money for the company to be paying to get another RN, especially if there is such a high turnover rate. When I was a newer nurse, I had my first job as an oncology nurse. I worked in step down, and I remember my very first night off of orientation. I had a patient load I thought was a little excessive at the time for me being my very first night off of orientation. So we all had 3 patients, which is our usual patient load, but my patients were very heavy. They all had multiple chemos throughout the night and multiple transfusions as well. Also, one of those patients could not speak any English at all, so I had to use an iPad translator. Basically, we had an app where we could go in and we had a translator app that we went into and actually brought a real translator up, so we video chatted with them, and I would tell them what I was trying to say to the patient. They would translate it to them, and obviously they would translate it back. So it was very hard, one, being a new nurse, dealing with that situation, to trying to figure out how I wanted to communicate with this patient and work around my other patients as well, because it took a very long time being in that patient's room, trying to interpret what they were saying and working with that translator to make sure I got my point across. So sometimes we can get 4 patient assignments, and we had another patient coming in, and out of all the nurses there, I was the one given the 4 patient assignment. So I also had a brand new patient coming in that I had to admit. So I just feel like this was very unreasonable for my very first night off of orientation, being assigned to very heavy patients, plus a patient having to use a translator and then getting an admission on top of it. So looking back, I feel like it really wasn't fair to me at that time. So the next day, I was actually reprimanded in front of my peers and confronted about a situation that happened the night before with the patient who needed a translator. So I guess he told another nurse, charge nurse, that I didn't use interpreter very well, and he was in pain, and I didn't confront him about it or ask him about it. So it was very upsetting to me to, one, be confronted in front of all the people that I worked with, and two, they just assumed that I didn't use the interpreter right and didn't use it at all, instead of asking me what happened. So at that moment, I was really upset with myself. I thought I was starting off being a bad nurse, and it just really put me down and just brought a lot of negativity to me and how I felt as a nurse. So I think that's why I'm very passionate about this subject, is because I remember being in that situation and knowing how it felt. And honestly, I was to the point where I didn't want to be in nursing at all. And that was a very sad and hard thing for me to go through. It is expected 1.09 million nurses will be needed by the year 2024. Training new nurses costs between $37,000 to $58,000 per nurse. I know the numbers on the previous slide were different. This information from the 37 to 58,000 was from a Med-Surg nursing journal. This is written by Sonia Blevins, and this journal is From Nursing Student to Registered Nurse, The Challenge of Transition. So that's just the numbers they got from that article. So when newer nurses experience horizontal violence, they are more willing to leave their position. Like I said before, newer nurses or younger nurses are more likely to leave compared to the older nurse. So when nurses do experience horizontal violence or vertical violence, they may be discouraged, and this can cause them to leave the profession completely. So they might not just go to a different job. They might not want to do nursing at all after that. So I believe to prevent and decrease bullying in nursing really starts with management. Having a zero tolerance policy regarding bullying is really going to set the standards and show that it's not tolerated on that unit. So it's going to help prevent and decrease if it does become an issue. Also, education, probably yearly education, would be beneficial to nursing staff, so they know not to do this and know how to prevent or intervene if they do see bullying happening on the unit. Encouraging unity to staff is beneficial. They're all going to work together and not bully each other. So support system that includes an educator, preceptor, and staff that encourages new nurses is really going to help them be successful in their job. They're going to be more willing to go to a nurse, educator, preceptor to ask questions, and they're not going to feel intimidated if the staff is welcoming. The main points I want you to take from this presentation is that bullying in nursing should not be tolerated under any circumstance. And if you see someone who's being bullied, you need to intervene. If you don't feel comfortable intervening at that exact moment, you need to immediately notify a charge nurse, supervisor, or manager so they can help resolve the issue. Because if you just continue to watch someone being bullied on the unit, you're kind of part of the problem as well, because you are observing this and not doing anything about it. Another thing is, remember what it was like when you were a graduate nurse. It's very scary and intimidating, and you want to do the best you can, and you just want to work together and have a good future and a good career. And lastly, just encourage success to newer nurses and younger nurses. Let them know you were in their position before, and just try to help encourage and educate the best that you can.